What is tuberculosis? It is commonly referred to in Sri Lanka as the cough disease or consumption. Tuberculosis is caused by a bacteria called Mycobacterium tuberculosis. It was discovered on the 24th of March 1882 by the German scientist Dr. Robert Koch. It is not a hereditary disease and is only as infectious as a common cold. Tuberculosis can be cured with proper treatment. Failure to take the right treatment for tuberculosis can be fatal. The TB bacteria can enter and settle in any part of the body. If it is located in the lungs, it will cause pulmonary TB. And in any other part of the body, it's called non-pulmonary TB. Most of the TB patients among us, that is about 80%, suffer from pulmonary TB. After the TB bacteria enters the body, it is involved in a battle with the body's natural immunity. In this encounter, other organs and tissues in the vicinity could be destroyed. If the bacteria wins the battle, their numbers will multiply, and soon the TB symptoms will begin to appear. TB is an infectious disease caused by bacteria. It is not hereditary. There are prescribed drugs to cure it. If the medication is taken properly, TB can be completely cured. Likewise, if the treatment is not properly taken, the patient can die. How does it spread? When a person infected by TB coughs, sneezes, or laughs loud, the drops of sputum or phlegm he emits contain the germs. Anyone breathing these germs will help them enter his body. This is called infection. Until a patient takes proper treatment, he will continue to spread the infection in this manner. He will infect his family members, neighbors, colleagues in his workplace, and other people he meets. A TB patient who does not take treatment passes on the infection to 10 to 15 healthy persons per year. Similarly, TB bacteria is easily spread among people living in unhealthy, congested dwellings or in places with inadequate circulation of fresh air. How the infection survives in the body. Once the TB bacteria enters the body, it can remain there for life. Yet, the bacteria entering your body does not necessarily mean you get the disease. only 10% of those who are infected actually become TB patients. A person suffering from TB who does not take treatment has a 50% chance of dying within 5 years. People of all social levels can become victims of the disease. A person with strong immunity can avoid getting infected. On the other hand, the chances of a person with low resistance contracting the disease are greater. There are several reasons why the body can have low immunity. Those who are HIV infected, those who suffer from malnutrition, those who are addicted to alcohol, drugs and smoking, those suffering from diabetes, and those who have been indulging in incorrect usage of drugs to treat certain ailments over a long period of time. Symptoms of tuberculosis. Appearance of the symptoms will confirm that the person has been infected. The symptoms vary depending on which part of the body the TB germs have entered. TB in the lungs will cause a cough which will last for over 3 weeks as its main symptom. This symptom exists in 95% of persons with pulmonary tuberculosis who emit phlegm with germs in it. But everyone who has a cough is not a TB patient. Other symptoms could be a cough accompanied by coughing blood with sputum, slight feverishness at night, loss of weight, heavy sweating at night, and loss of appetite. None of these symptoms necessarily mean that one has TB. Hence, it is important that a person having these symptoms should consult a doctor. Identifying a TB patient. In every instance where a patient has had a cough for over 3 weeks, he must see a doctor. The sputum microscopy test is to identify TB. The most important test for diagnosing TB is the sputum microscopy test. It is accurate, simple, and inexpensive. This test involves the use of a microscope to confirm the presence of the TB bacteria in the sputum. In addition, an X-ray is taken. Also, in some instances, a blood test is done. We consider the sputum sample test essential for diagnosing TB.
ක්ෂයරෝගය හඳුනා ගැනීම සඳහා සෙම පටල පරීක්ෂාව ඉතා අත්‍යවශ්‍ය පරීක්ෂණයක් බවට අපි දකිනවා. මෙම සෙම පටල පරීක්ෂාව
It is also the most successful, simple, convenient, and inexpensive form of diagnosis. A patient is required to provide 3 samples of sputum for testing. For this purpose, sterile containers are provided by health centers and clinics. If TB is diagnosed in its early stages, it can be cured quickly and easily. It also minimizes the damage caused to the lungs. During the course of treatment after diagnosis, it is also important to have regular sputum tests done which will indicate whether the treatment is taking effect. The first sample is taken on his first visit to the clinic. For the second sample of sputum, the patient is instructed to take his first emission of phlegm he coughs out the very next morning and bring it to the clinic. The third sample is obtained from the patient on his second visit to the clinic under the supervision of the staff.
අපේ රසායනාගාර පරීක්ෂකයින් ඉදිරියේ අපි රෝගියාට කියනවා නැවත සෙම පටලයක් අපිට ලබා දෙන්න කියලා. ඒ විදිහට තමයි අපි සෙම පටල 3 ලබා ගන්නේ.
Treatment for tuberculosis. Tuberculosis is treated with antibiotics. An uninterrupted course of prescribed treatment for 6 months will ensure a complete cure of the disease. Tuberculosis is a notifiable disease. A patient diagnosed with the disease has to inform the district chest clinic through the local health clinic. The district chest clinic will in turn communicate this information to the Statistics Division of the Central Office of the National Program for TB Control and Chest Diseases. This information is required to maintain a record of the TB patients in the country. Since the TB bacteria is more potent than other disease-causing germs, a daily 6-month period of medication is essential to combat the disease. Although the patient will experience relief after a short period of treatment, it is essential that the full course of treatment is taken for the prescribed duration to ensure absolute cure. The period of treatment will be determined by the doctor, depending on the patient's condition. A TB patient being treated for the first time will usually need to follow a 6-month course of medication. However, there may be some patients who will need to follow a course of treatment for a period exceeding 6 months. Patients following the 6-month course of treatment will be prescribed 4 different drugs. This prescription will be reduced to 2 drugs after the first 2 months of medication.
ප්‍රතිකාර ගැනීමේදී වැඩියෙන්ම නිවසට වෙලා ප්‍රතිකාර ගැනීමේදී වගකීමක් ඇතුව ප්‍රතිකාර ගැනීම ඉතාමත් වැදගත්. ඒ කියන්නේ දැන් ශාරීරික ඖෂධ වර්ග 4ක් විතර පළවෙනි මාස දෙකට අපි ලබා දෙනවා. ඒ ප්‍රතිකාරයේ ප්‍රමාණයෙන් කියන්නේ අපි නිර්දේශ කරන ප්‍රමාණයෙන් ගැනීමත් ඒ කාලය තුල
It is important for patients to be careful and strictly follow the doctor's instructions when taking their medication. If they do not take their drugs as prescribed, they are exposed to the risk of the germs building up resistance to the drugs. This will make the treatment both difficult and expensive. So the message is, take your medication regularly and for the prescribed period. If you have any problems or reactions to the drugs, you should consult a doctor.
අපිට දෙන්න යුතු පණිවිඩය නම් මේ ප්‍රතිකාර ගැනීමේදී ප්‍රතිකාර හරියාකාරව ගැනීම යම් අතුරුආබාධයක් සමන්ට පෙනෙනවා නම් ඒ අතුරුආබාධය කුමක්ද කියන එක වෛද්‍යවරයෙක් සමග සාකච්ඡා කරලා බලන්න යුතුයි.
Taking the right drugs. Why it is important for a TB patient to take the right course of drugs and the correct dosage in the prescribed period. Today, TB is a disease that can be cured. There are drugs available free of charge, and if these drugs are taken properly, it can definitely be cured. If the medication is not taken as prescribed, it will be like the mosquito which becomes immune to DDT. The drugs will not have any effect on the germs. This is a dangerous situation because we have no other way to destroy the germs but with the drugs available. This creates the condition called MDR-TB, which cannot be cured because it does not respond to the drugs. This can result in death, as drugs required to treat MDR-TB are also very expensive and will amount to thousands of rupees for a patient each month. But there is no guarantee that the patient can be cured even after several years of this expensive treatment. This will be a tragedy because this unfortunate situation can be avoided if the patient takes his medication according to the doctor's instructions. Fortunately, this situation has not reached serious proportions in our country. But in recent years, we find that there has been an increase in the number of patients neglecting their medication and becoming victims of MDR-TB. Failure to take the right treatment for the full duration of the prescribed period will result in the patient's death. Similarly, a patient who does not complete his course of drugs will be a carrier of the disease until his death. Directly observed treatment short course. The best way to control the spread of TB is to identify, treat, and cure existing TB patients. This will significantly contribute to a decrease in the number of MDR-TB infected persons. Therefore, speedy diagnosis and proper treatment is absolutely essential. A patient is required to take the prescribed course of drugs for a period of 6 months and strictly follow the doctor's instructions under supervision.
ක්ෂයරෝගීන්ට ප්‍රතිකාරය ලබා දෙනකොට හොඳම ප්‍රතිකාර වට්ටෝරුව ලබා දෙන්න. ඒ කියන්නේ මාසහේ වට්ටෝරුව. ඒ වගේම මේ ප්‍රතිකාරය අධීක්ෂණයක් යටතේ ලබා දෙන්න කියලා. එතකොට මේ ක්‍රමයේදී අපි සෑම ක්ෂයරෝගියෙක් වෙනුවෙන්
According to this method of treatment, after we have diagnosed the patient with the disease, we appoint someone to observe the patient's progress. This is done in consultation between the patient and the doctor in the clinic. It is important that this observer should meet 3 essential requirements. Firstly, the observer must be located in close proximity and have easy access to the patient. Secondly, the monitor should be a person acceptable to the patient. Thirdly, it should be a person who will handle this responsibility for the health service. We will only select a monitor who can match up to these requirements. We will then refer the patient concerned to a health clinic of his choice for treatment. The patient will then receive the prescribed drugs from the chest clinic. The patient will be instructed to take his medication in the presence of the observer by mutual arrangement.
ඔහු කැමති සෞඛ්‍ය ආයතනයක් වෙතට යවනවා. එතකොට ලයි චිකිත්සාගාරය මගින් එම ආයතනය වෙත එම ක්ෂයරෝග බෙහෙත් ලබා දෙනවා. එතකොට මේ ක්ෂයරෝගියා මේ ප්‍රතිකාර අධීක්ෂණය කරන පුද්ගලයා ළඟට ගිහිල්ලා මේ බෙහෙත් ටික බොන්න ඕනේ. එහෙම නැත්නම් මේ රෝගියාට යාමට ඒමට අපහසු නම් ප්‍රතිකාරය අධීක්ෂණය කරන පුද්ගලයා මෙම රෝගියා ළඟට ඇවිල්ලා බෙහෙත් ටික ලබා දෙනවා.
Side effects of TB drugs.
රෝගිය සඳහා ප්‍රතිකාර ගන්න ඖෂධ ලබා ගන්න කාලය තුලදී
During the course of the treatment, the patient should avoid eating blood fish such as tuna. Many TB patients complete their courses of medication without any serious side effects. In some instances, patients may suffer side effects from the medication and they should be warned of this in advance. In instances where side effects are not serious, the patient should take the medication regularly as prescribed. If the side effects are serious, the medication should be discontinued. and the doctor should be consulted immediately. Among the non-dangerous side effects are body aches. The therapy here is to eliminate any fears and doubts in the patient's mind and reassure him to continue medication. Another symptom is the patient passing red or discolored urine. This is a condition caused by the drug rifampicin, but is not considered a side effect. The patient can continue medication and bring it to the attention of his doctor. Another non-dangerous side effect is a mild skin irritation without a rash. Here too, the medication should be continued. Dangerous side effects. These are skin irritation accompanied by a rash, nausea and vomiting, eyes turning yellow in color, and impaired vision. The prescribed remedial action for these conditions is to discontinue the medication and consult your doctor. In some instances, antibiotics used by a TB patient could cause side effects. Patients should be advised to inform a doctor who will prescribe remedial action. Here's the story of a patient who was cured of TB. I had a cough for about 2 or 3 months and had fever regularly in the evenings, and I was losing weight. That scared me. I then took treatment from some clinic nearby, but did not get any relief. Then a neighbor advised me to go and have myself checked at the chest clinic in Borella. I went there, and the doctor advised me to have 3 samples of my sputum tested. After I completed the 3 tests, he confirmed that I had TB. I was both depressed and scared, but the doctors at the clinic assured me that if I took a 6-month course of treatment, I would be completely cured. Thereafter, I attended the clinic daily and took the drugs. After about 1 month of treatment, my cough was completely cured. I feel much better and I got back my appetite. But I continued taking my medicine since I was advised that I should complete the full 6-month course of treatment to be completely cured. I took the full course of medication for 6 months without a break. It was very convenient because the drugs have to be taken only once a day in the morning, and I was also able to continue my job, which I still do. I am now completely cured of TB. And I lead a very healthy, normal life.
සෞඛ්‍ය තත්ත්වයෙන් ඉන්නවා. ඉතින් දැන් මම සාමාන්‍යයෙන් ජීවිතයක් ගත කරනවා.